My name is Fulvio. I'm a plastic surgeon based in Eton. I wanted to speak to you about fibrosis following liposuction. How do you know if you've got it? And if you have got it, how can you treat it? So this lady had a body contouring procedure, very nice result. It was performed with power-assisted liposuction, micro-air, LipoSaver, which is ultrasonic assisted liposuction, and Renuvion, which is a minimally invasive tissue tightening technology, and that works really nicely, as it did in this case. And the patient was sending us these images soon afterwards. So that is the result immediately after surgery. That was week 1. She kept sending us lots of pictures. She was really very happy. These continued, but at around this week 3 mark, we're seeing that something's not quite right. You're beginning to see a little bit of excess tightening, and that's where I started to suspect that something might go amiss. And sure enough, the following week, she had this very lumpy, abnormal looking, irregular, tight result. I've got to say, I'd never seen it before in my own practice. I've seen many other people's fibrosis, but having been liposuctioning for between 10 and 20 years, actually this was the first case of fibrosis I had personally experienced in one of my own patients. So what do you do about it? Well, the traditional thinking is that you treat with radio frequency treatment, and that is what we did. We got the lady in and had several radio frequency treatments a week delivered at the clinic, and it did bring about an improvement. As you can see, this is better. This is after a couple of weeks of treatment, but it's not better enough. And the established wisdom is that you continue massage, radio frequency treatment, and then wait a full year. And if things are still not as they should be, then you proceed to surgery and you reopen, you release the scar tissue that's underneath, that is the fibrosis, holding it in place. You might do a little bit more very gentle liposuction here and there. You might even do some fat grafting. It's not a road you really want to go down. Technology. Enzymes are proteins that are produced naturally by the body, and the particular enzyme we're interested in is collagenase. Collagenase destroys collagen. Now, most of the time in medical aesthetics, we are interested in making collagen. Indeed, Renuvion works by stimulating collagen production and bringing about tissue tightening in that way. So why would we want to destroy collagen? It's not collagen we don't like in these situations, but it's abnormal collagen. Collagenase is an enzyme that can only get in and attack collagen if that collagen is in some way abnormal. Collagen is a triple helix, like a rope in a coil, and the collagenase enzyme can only get into little frays in the outer structure of that triple helix. So it specifically targets damaged collagen, and it can, by removing it, then give your body a reason and an opportunity to make new stuff. So it essentially remodels abnormal collagen. I explained to the patient what I had in store for her, and this is my plan for where I was going to inject all this collagenase. It's just an in-clinic treatment. It's pretty straightforward to do. You clean the area and you inject wherever you feel that you need to inject. Patient and I are chatting happily throughout. I hope you like the natty pink gloves. Not my choice, but there you go. It takes about 10 minutes to do. It's a really straightforward in-clinic treatment. And the results were pretty dramatic. The patient was messaging me to tell me that it had made a massive difference on massage. So her therapist was telling her it made a huge difference. She said that she felt a bit sore afterwards and she could tell it was working, but just immediately noticed a difference. A few days later, she's back from being in tears, what have I done to myself, to taking happy selfies in the mirror and telling me it's just so much smoother and softer. For a while, she was actually having trouble breathing. It was so tight, and it just had an immediate response. A couple of weeks later, I followed up with her, and this is where we ended up. So she's back to having that just sort of beautiful, sculpted, lovely result that I had actually left her with on the operating table. So my take-home message from this is, if you have fibrosis, please don't despair. There are things that can be done. It's simple, it's straightforward, it's in clinic, but the sooner you treat it, the better. It's much more effective within 1 to 6 months. If it's been a year, look, we can still do it, but there is no good reason just to stop and wait. Please, as soon as you know you've got fibrosis and the treatment methods that you're using don't seem to be doing enough, please make contact with us. We can help. So I hope this is useful. Please let me know if you've got any comments about this. I'd love to help. All right, take care. Bye-bye.